Happy New Year, everyone. Andrew Wolf at the Center for Cosmetic Surgery. Like many of us, I have made some New Year's resolutions, and one of the things I'm going to make a concerted effort to do is to stay more in touch with future patients, past patients, anybody who might be interested in the practice and what we do. And so towards that end, this is the first of what I hope to be a regular series of videos and audio snippets that might contain some information and inspiration, call it what you will, things that might be of interest to you. So, first one is going to be an answer, or at least a partial response to probably the most frequently asked question we get when people first contact our practice, which is, why are you booked out so long for a consult? So if you call our practice right now, and it is January 2nd, 2022, so I'm wasting no time with that resolution. If you call the practice now and ask to see me for a consult, it's going to be approximately 11 to 12 months before I can get you in. So we're booking into really November, almost December of this year. It's a challenge, and we'll get into some of the reasons behind it and talk about some of the things we can potentially do to mitigate that for you. First and foremost, why are we booked out that long? And it's a really multifactorial situation. If you look back 2-3 years ago, back in the before times, right, pre-COVID times, we were typically booked out for anywhere 3, 4, sometimes 5 months, depending on whether it was a busier season or not. And that was a very manageable time. People could call, they could get in to see us for a consult in what was considered a reasonable time frame. And then COVID hit. And obviously it's a game changer in virtually every scenario that you can imagine. But for the practice, last year, about 18 months ago, we were shut down for 5 or 6 weeks as part of a mandated shutdown in all elective procedures in the state of Colorado. And I was sitting at home and doing some Zoom consults. So I was trying to stay active, and I would do a couple days a week of Zoom consults and talk to some patients. But beyond that, we were really dead in the water. And it was a really challenging time for me, for us as a practice, for many of us in the elective surgery world. And because I was talking to friends both in Colorado and around the country, we were all really terrified that the floor was going to fall out of the elective surgery world, because in the midst of a pandemic with financial challenges and people losing their jobs and worried about their health and really apocalyptic scenarios, who in the world is going to want to have elective surgery? Who's going to want to have a facelift or a tummy tuck or a breast augmentation? And the answer is apparently everyone, right? Everybody for the past 18 months has been trying to get in to have plastic surgery. And obviously it's not everyone. This has been a very bifurcated experience in the sense that there are many, many people, and I don't want to minimize that. There are so many millions of people who are struggling financially with their health, the loss of a loved one. And so there is a large segment of the population that has really been overwhelmed by this, but there is a strong demand for all of these really elective luxury goods. You look at real estate, you look at auto sales, you look at plastic surgery, right? All of these things are in incredibly high demand. And I've tried to parse out why that may be. And it is probably some combination of people being able to recover at home, because lots of people are either working remotely or taking extended time off from work. And so they have time to recover in a way that maybe they didn't pre-pandemic. People are not traveling as much as they used to. And so someone who was planning maybe taking a European vacation is for their 50th birthday finds that they're not taking that trip, and now they've got these funds that are allocated to something fun, and maybe that's a facelift, right? Maybe that's a tummy tuck that they've been thinking about for a long time. It could be that there is this sense that life is short and this is something you've always wanted to do, and if not now, when? That kind of approach, whatever it is, the demand has been really off the charts. And our practice is incredibly busy. I'm incredibly busy personally, but many of us are. There are lots of people in town who are, booked out 3 months, out to 8, 10, 12 months. It is a function of demand and the supply of time that I have as a surgeon. I can only do so many consults a day. I can only do so much surgery in a day. And so really it's a function of that, right? If you, I can typically see anywhere from 10 to 13, 14 consults in a day. And I do about one consult day a week, sometimes one and a half, depending on surgical demand and how consults play out. And I could see more consults. I could probably do 20 consults in a day, but any of you who've been in to see me for a consult or have a friend who's seen me for a consult, it's a very intensive learning experience for both of us. So hopefully I can educate you on some of the procedures that you may be considering. I'm doing my best to learn what are your desires, goals, requirements as a patient, and is this the right procedure for you? If not, is there something else that might serve your needs better? Am I the right surgeon for you? And again, if not, is there someone better suited to get you where you want to go, right? And that's not something that happens in 5 minutes. And so we're going to talk about your medical history. We're going to talk about your anatomy, meds you take, like all the basic medical things. But then we do a pretty deep dive into what your goals are aesthetically, functionally, and whether the procedure you have in mind is going to get you there. And if so, how does that work? And then we have 3D imaging. And if we're talking about breast surgery with implants, there's a variety of different ways to help you visualize what a given implant might look like on you. We look at before and afters. It's a pretty comprehensive experience. And that's what I like to do. I don't want you meeting with a patient counselor and then spending 5 minutes with me. If it's going to be 50 minutes in my office, you're going to get 45 minutes of it with me. And so I need to do that to make sure that I'm comfortable with you as a patient. And I would think that you would want it to have that same kind of experience from your end, because I know I would. I'm not the fastest consultant in the world, and so I don't get to see as many consults as I might. That's part of it. It is a challenge, and I understand that many patients call and they're frustrated. And fortunately, I'm not the one who has to answer the phones for the most part and discuss why we're booked out for so long and why that's an untenable situation for a lot of people. It is a challenge for us as a practice because obviously we're going to lose people. Somebody who calls and says, I was planning ahead and I need to have surgery in the next 6 months for a wedding or a reunion or whatever it may be, right? That's my time frame. I'm taking a sabbatical. This is the window in which I might have surgery. Then if we're outside that window for you, it's a challenge. There are absolutely people who are waiting 10 to 12 months to see us. And so I absolutely do my best to keep that in mind when I see somebody. And very commonly I'll ask, how long have you guys been waiting for the consult? And it's humbling to me that somebody would wait that long with this kind of goal in mind. So this is a double-edged sword for us as a practice, for me as a surgeon, because people come in with a lot of expectation, right? This has been built up in their minds for 8 months, 10 months. People may have poured over our website and been on our Instagram, all the different ways you might get to know us as a practice, get to know me as a surgeon. And so they come in with this a whole host of expectations that I need to meet, right? Because you think of the buildup. They are ready to be impressed, because anything in your mind, anything that you've waited 8 months, 10 months for, it's going to be, I know it's going to be great because it has to be, because I've waited this long. And so people are ready to be impressed with the practice, with the facility, with whatever the experience may hold for them. At the same time, the opportunity to disappoint someone is pretty significant, because if you show up after that long wait and the experience is less than exemplary, you're going to be, I think, deflated. We take that very seriously. My staff and I, we talk about it all the time. We'll do a group huddle at the beginning of every consult day, and we talk about who's coming in and how's the patient flow going to be, and how do we best optimize the patient experience? Because that's really what it's about. It's about the patient experience both from the absolute very beginning, which is when you contact the practice, who are you emailing, who are you calling, how are you treated as a potential patient? Is it timely? Is it courteous? Right? Are you getting professional responses? All of that through the consult experience, which is a big, big part of it, but then into the pre-surgical, surgical, and post-surgical realm. All of those things craft your experience, and it starts the minute you first contact the practice in some way. And it's not necessarily calling or emailing us. It may be looking at our Instagram feed or whatever it may be, the website, all the way through that last visit, which is at 6 months or a year post-op. And we sign off and say, okay, call me if you ever need anything. We're always here for you, right? That can be a 18-month, 2-year kind of window, maybe even longer. In summary, we're booked out for a long time because I'm pretty good at what I do. We got a lot of people who are interested in the practice. There's only so much time we have, and we're trying to make every consult as complete as it can be. Best tips I might have for somebody who's evaluating the practice, looking to get in for a consult: plan ahead, right? If you're pregnant with your last child and you're doing your gender reveal party, schedule your consult at the same time. Right? If you've got 4 months left in your pregnancy and you think you might want to evaluate tummy tuck or breast surgery, any of that stuff, and it sounds, it sounds like a joke, you got to plan ahead for a lot of this. Most good surgeons are going to be booked out for a long time. And so find someone that you might be interested in seeing. Hopefully it's us. If it's not, there's other excellent surgeons in town. But you got to plan ahead for this. These are major life decisions. They carry significant cost and risk and recovery. And so it's not something you want to rush into. It's not something you want to find somebody who can fit you in a week or two. Not that you couldn't get a good experience with that, but it's, I think most of us who are experienced and talented are going to be booked out for a long time. So expect that. At the same time, if you call, we do have a wait list that is it can't necessarily shorten you that much, but it can. There are times where somebody calls and we can fit them in a matter of weeks because they happen to have an opportunity to come in during a cancellation where nobody else could sign up and they can get in. So for sure, if it's important to you to get in sooner rather than later, let us know. We can get you on a cancellation on a move-up list. These are, especially now with Omicron, our schedule is in constant flux. And I can't tell you how many emails a day I get about scheduling changes for both surgery and for consults. And there's opportunities to move up. So let us know. If you have a deadline, and it is super important that you see us sooner, and you've got a real strong connection to the practice. I did surgery on your sister, your mom, your best, somebody up the street. Let us know, because we absolutely keep those things in mind, and we'll do our best to fit you in when it works for you. At the end of the day, as I said, there's only so much time of the day in which I can see consults. And so for those of you who are waiting to see me, keep the faith. I look forward to seeing you when we do eventually meet. If you have any questions at all about this, you can always reach out to us via email, via our phones. Everything is listed on our website at www.thecenterforcosmeticsurgery.net, also denverccs.com. Andrew Wolf, Center for Cosmetic Surgery, with the end of my first FAQ. I'm excited. I actually accomplished something. I've been trying to do this for a long time, and so it took a New Year resolution to get me to do it. My staff will be pleased. If you have other questions that you'd like me to address personally, feel free, right? The more we hear questions, that's what makes them more frequent, the more likely we are to address them. And so we're always happy to chat with you, email with you, reach out. Happy New Year. Hope to see you again soon.